Signs of sexual exploitation of minors in the clinical setting can be very broad. So you want to make sure you have a good system and you're looking at a variety of things. The first thing you want to do is generally look at your patient and ask yourself if him or her seems fearful or anxious. Do they actually want to be in the clinical office with you? Do they seem like they can make eye contact? They can move around freely? Also, are they with somebody? Is that somebody a friend, a guardian, a parent, or is it a stranger that your patient is afraid of? Is your patient in control of his or her own finances? Do they have a cell phone? Are they allowed to be alone with you without the person with them? These are all small, subtle things that you want to take note of because anything that seems abnormal could be a red flag. Now, the next thing you want to do is look at any signs specific to sex trafficking. Look to see if your patient is dressed appropriately for the weather outside. Are they scantily clad in comparison to what you would expect? Also, do you see any tattoos that are noticeable? Because some tattoos, such as a barcode or even something that says property of or daddy, could also be a sign of sexual exploitation. Now listen to your patient. Does this minor speak in a way that's consistent with his or her age? Are they using a lot of street slang? Are they talking a lot about street terms about sex trafficking? Are they making sexual jokes? Again, take all this down because anything that's not consistent with the age, again, could be a red flag. Now you're onto your physical exam and you really want to make sure you're looking for any signs of abuse. Signs of physical abuse could be things like bruising, traction marks from hair pulling, dental fractures, cuts, bruises, cigarette burns. You may also see tattoos that you didn't readily see earlier when your patient was sitting in your office. During your physical exam, also take note of your patient's hygiene. Do they look like they've been regularly getting showers or baths? Do they look like they've been able to see a dentist or see a doctor regularly? Look for signs of malnourishment. Now, you also want to make sure you try to do a physical exam looking at the genital urinary area. Now, again, this may be difficult if your patient doesn't trust you or if your patient doesn't let you be alone without this person that's with them. But let's say you're able to do one. Look for signs of trauma. Look for signs of sexual abuse. Do you see a retained foreign body? Do you see cuts? Do you see signs of forced penetration? And while you're doing all this, does your patient seem comfortable? Does your patient seem like he or she is okay with the physical exam? Because any sign of distress or anxiousness could also be a red flag. Now, one other thing that you want to do is assess your patient's mental health and social development. Minors who have been abused or sexually exploited are at risk for a host of mental illnesses, things like depression, PTSD, anxiety, and so forth. So if you notice anything's off, make sure you document that as well. And last but absolutely not least, take note to see if your patient's intoxicated or under the influence of something, and make sure you ask questions about high-risk behavior, because some minors who are being sexually exploited are also facing other high-risk activity. They may be running away a lot. They may be involved in drug abuse. They may have a very high number of sexual partners. Make sure you're documenting all of this. And when you're talking about high-risk behavior, don't leave out the sexual health. You want to know, do they have a history of recurrent STDs, sexually transmitted diseases? Do they have a history of unwanted pregnancies? Do they seem like their sexual experience is a little too advanced for their age? So again, by looking at the whole patient, from general to mental health to social development to personal security to physical exam, you hopefully can work a systematic approach and look for any red flags of sexual exploitation.